I would want to know, as a psychiatrist, how do you conceptualize this hormonal choreography? And what are, some of the most significant neuroendocrine shifts that predispose women to mood, or you can say anxiety disorders, during this time?
Well, I think one of the interesting things about this time is that we still don't have it all figured out. So we're still learning and understanding how is it that estrogen and progesterone and testosterone and cortisol, how are they interacting in the brain and what reactions are they having in the brain to cause certain mental health disorders, mental illnesses, or stress reactions. And so that's all still an area of active research, which I think is exciting, but it leaves us with a lot of questions in this time period. And so what we've kind of gathered so far from research is that it isn't necessarily the hormone levels of estrogen or progesterone that likely has an effect on our mental health, but it's more the way that those levels are changing and kind of the degree in which those levels are changing and how quickly they change. And so in pregnancy, when estrogen and progesterone are going up higher than they will at any other point in our life, that's a big change for our brain to handle, especially because those hormones have receptors inside of our brain. And so it's actually changing how our brain is reacting and functioning. And then you go postpartum when the placenta gets delivered and estrogen progesterone plummet, and then our brain has to shift again. So it seems like most people's brains, when these hormone shifts happen, we can kind of accommodate for it. But I think all of us notice changes in our mood, like in pregnancy or postpartum. It's very common for people to feel more emotional or to feel like they're more sensitive to things. But in certain brains, I think that are predisposed to mental illness, those shifts can just kind of trigger anxiety or depression or other mental illness symptoms to show up.